Be an overwhelming feeling getting slapped with a hospital bill that you don't believe you owe.
Tonight, our I-Team investigates surgery overcharge. A local man billed $47,000 more than he should have been.
Consumer investigator Jason Knowles tonight looking into this case, and he's here with results. Jason.
Cheryl, Rob, the South Suburban man says he had his surgery pre-approved with the hospital and insurance, but then the sticker shock and a surgery overcharge, a bill for 8 times more than he thought. He called the I-Team for help. Lansing resident Joe Dubchek was relieved to know he beat prostate cancer, but he couldn't believe his eyes when he got this surgery bill for more than $53,000.
Is a shock, and learning you have cancer is scary, but that whole process was easy. This has been 10 times more stressful than the surgery itself and the recovery.
Dubchek thought his bill was going to be about $5,800, as noted in this initial document. Yeah, it says you pay $5,800.
Right.
He got the surgery pre-approved through Advocate South Suburban Hospital and Blue Cross Blue Shield of Illinois.
Everything went as planned until a month after the surgery, when I got a bill for $53,500 plus.
Wow.
So right away I thought, well, Blue Cross couldn't have seen this yet, or they're still sitting on it or something.
But after making calls to the hospital and his insurance company, he found out that the $53,000 was the final bill, and he had to pay up.
And so the last 5 months now has been back and forth between Blue Cross and the hospital, neither one of them wanting to fix this, although they both acknowledge something's wrong. So the hospital has been very aggressive at trying to get funds from me.
He says when he wasn't getting answers, he called the I-Team.
I just kind of gave up, and that's when I contacted you.
I emailed the hospital and the insurance company, sending them documents showing Dubchek's pre-approved estimate and documents showing that he was only supposed to pay $5,800.
Keep an eye on it. I just wanted to give you an update.
Within weeks, Dubchek got a call.
The vice president of consumer affairs for the company that oversees Advocate Aurora Health, and apologetic, and we're working on this, and we're working with Blue Cross.
Weeks later, he got updated bills showing he no longer owes the extra money.
I am so grateful that you were able to do this. I don't know what you said in your email, but I really appreciate your help.
I'm glad we could help. Advocate South Suburban Hospital and Blue Cross Blue Shield of Illinois did not comment specifically on the patient's case, but sent me these statements. Advocates saying we are committed to guiding patients as they navigate and plan for the cost of their care, and we have a process in place to work with patients and insurers to resolve issues when appropriate. BCBS of Illinois saying we are committed to putting members first and working with providers to help them receive appropriate covered services. Anyone who has a concern about coverage should reach out to us at the number on their member ID card. Dubchek says he never got a detailed explanation for the error, but says he was told by insurance that there was a coding issue. Dubchek says the hospital was out of network, but he had an out-of-network waiver as part of his pre-approval.
It's very stressful, and it's unacceptable.
You should always carefully review all hospital bills. If there is a problem, fight the bill before sending any money. You can formally dispute those bills with the hospital, insurance, and collection agencies. Rob, Cheryl, if you can't get your issue resolved, you can also file a complaint with the Illinois Department of Insurance. But what a mess for this guy. So glad that we were able to help. He says he would not have been able to pay this bill.
Wow, you provided some much comfort for him.
Thank you. Something like that happens to you, you also call the I-Team.
Yeah, we want those calls to keep on coming.
Great work, Jason. Thank you.
Time for your weather forecast.